Coming to the ECG examples of VT. Here we can see the monomorphic VT. All QRS complex looks similar. Okay, uniform QRS complex, axis cannot be determined, very broad QRS, 200 milliseconds almost, and there is a notching near the S wave. This is typical. This is notching is there. That is also called Josephson sign, and it is typically seen in ventricular tachycardia. This is a polymorphic VT. Here we can see all QRS complexes are of different morphology, no axis determined, and wide QRS complex is seen. So this is a polymorphic ventricular tachycardia. This is ventricular fibrillation. This is a very important and very dangerous situation. It is a final call before departure, and there is urgent action is required in case of ventricular fibrillation in the form of early defibrillation, unsynchronized defibrillation. Then you can also here need of CPR, and this rhythm is a shockable rhythm. Remember, this is a completely chaotic, irregular and disorganized ventricular contraction, and this is a immediate urgent action is required in such patients. Okay. Now coming to the differential diagnosis of wide complex tachycardia. Differentials क्या क्या हो सकते हैं? Ventricular tachycardia हो सकता है SVT with aberrant conduction due to block, SVT with aberrant conduction due to WPW syndrome, pacemaker mediated tachycardias, metabolic tachycardias like hyperkalemia, and patient poisoning with the sodium channel blocking agents like tricyclic antidepressants. Okay. Sometimes differentiating between the various causes of wide complex tachycardia is challenging and is not always possible sometime. All right. But there are some clinical features that favors more of ventricular tachycardia, like age is more than 35, structural heart disease. यदि किसी पेशेंट को पुराना कोई structural heart disease है, like valvular problem है, myocardium scarring है और myocardial hypertrophy है, so that all favors of ventricular tachycardia. Ischemic heart disease, old MI, congestive heart failure, cardiomyopathy, family history of sudden cardiac death like HOCM, congenital long QT syndrome, Brugada syndrome, on arrhythmogenic right ventricular dysplasia, that are all associated with the episodes of ventricular tachycardia. So these are the important points, important clinical features suggestive of ventricular tachycardia. But remember, whenever you are in doubt, if in doubt, treat as VT. So if any rhythm is wide complex tachycardia, and if there is a doubt, so better to treat that rhythm as a ventricular tachycardia. So thank you so much for watching the video, and always do practice more to learn to understand ECG better. Keep learning, keep growing, and see you all in the next video.